Okay, and then next I want to talk to you a little bit about go into a little deeper dive around the trending feature of this monitoring system. So with the Alyssa Guardian product, you have the ability to trend your patient's vital signs. And this was a completely new and innovative piece to me that I just thought is really going to transform how we care and how we monitor and assess our patients. This is a tool that we haven't had before. And the beauty of this is it really allows us much earlier intervention, which also allows us to make informed decision making. And I just wanted to give you a very brief story that I had encountered while I was at a bedside not too long ago. So I had what we would call a primary care baby, which really what that means is when the baby was born, he was very, very, very sick, very premature. And so they anticipated his stay to be a very, very long stay. And when we have kiddos like that in the NICU, we often will assign a primary nurse that says, you're the primary nurse that's going to, every time you're on, you're going to care for this baby. And you're really going to be kind of a key component in this child's care and his advocacy and so on and so forth. And so I think he was about 5 months old or so, and I had been his primary nurse for all 5 months. And he was just about ready to go home. You know, we were all getting excited. He was eating well, he was doing well. And I just got that hunch, that nurse hunch that something wasn't right. And it was just really small changes. And so I escalated my concerns to the physician. And, I told him about the vital sign changes, and he says, no, they're fine. They're within normal limits. And I said, they are within normal limits, but they have changed for him. I promise you, they have changed for him. These are small changes that I'm noticing, and there's something wrong with him. Like, we need to do some labs. We need to escalate care here. And he said, no, I'm not going to order any labs. The vitals look fine. And then the vitals changed even a little more. And so I escalated again, and he said, no, they're still fine. They're within normal limits. Well, by the time we continued to escalate, of course, that escalation process takes a lot of time, and the baby started to get into really big trouble, and ended up coding, and we were able to support him. But I really think if we had technology like this, where we're absolutely able to trend those very small changes, even though they are considered, quote, within normal limits, we can see how the patient is trending over time, and visibly be able to see those changes, those minor changes and trends. We can do what we're supposed to do and intervene early. And that would just be one more piece of data that I could have had to advocate for this patient, to say something isn't right. I don't know what it is yet, but something isn't right, and the vitals are telling us that. So just want to share a very brief story with you, and how I wished I had this technology with me on that day when I was trying to advocate for my patient.